25% of patients referred to renal units with ERF following Russell's viper bite suffered oliguria for more than 4 weeks, suggesting the possibility of bilateral renal cortical necrosis. This can be confirmed by renal biopsy or under CT, require regular maintenance dialysis and even transplantation. Heparin is ineffective against venom-induced thrombin and may cause bleeding on its own account. Hence, it should never be used in case of snake bite. Neither aspirin for headaches and myalgias, etc. Criteria for fasciotomy. Hemostatic abnormalities have been corrected. Clinical evidence of intercompartmental syndrome is there. That is severe pain, tenseness, hyposthesia. Intercompartmental pressure above 40 millimeter mercury. This can be assessed by spirometers. Now coming to pregnancy and snake bite. There will be fetal distress, fetal bradycardia, vaginal bleeding, threatened abortion, monitor uterine contractions and fetal heart rate. Lactating women can continue breastfeeding. Fetal demise is difficult to predict because of associated symptoms such as coagulopathy or hypertension and complications of treatment including anaphylaxis. Generally speaking, the severity of the mother's clinical course seems to be the best indicator of fetal survival. Pregnant patient is treated the same manner as non-pregnant patients, but spontaneous abortion, bleeding, fetal death and malformations are very common. It does not cause a placental barrier, and breastfeeding is allowed also. Symptoms and signs when venom has not been injected. And we mostly get this sort of patients. Some people who are bitten by snakes or suspect or imagine that they have been bitten may develop quite striking symptoms and signs even when no venom has been injected. This results from the understandable fear of the consequences of a real venom bite. And such people may overbreathe so that they develop pains and needles of the extremities, stiffness, tightening of their hands and feet and dizziness. Others may develop vasovagal attacks after the bite or suspected bite, faintness and collapse with profound slowing of the heart, most common. Others may become highly agitated and irrational and may develop a wide range of misleading symptoms. Another source of symptoms and signs not caused by snake venom is first aid and traditional treatments wrongly rendered. Constricting bands or tourniquets, ingested herbal remedies, installation of irritant plant juice into the eyes causing conjunctivitis, forcible insufflation of oils into the respiratory tract causing aspiration, pneumonia, bronchitis, etc., etc. Incessant cauterization, scalding liquid, heating over a fire, resulting in devastating injuries. Now coming to one journal view. This is from Banaras Hindu University. Its journal in the year 2007. This is for to support that early cardiorespiratory support with anti-snake venom, how important it is. 13 patients with severe neuroparalytic snake venom are admitted in ICU with respiratory failure over a 4-month period. Initially tosis of pneumonia, followed by valvular palsy, respiratory muscle weakness, was the common sequelae. All of them received cardiorespiratory support with mechanical ventilation. This is from anesthesia department. Anti-snake venom, median dose of 20 vials, and anticoagulant therapy, except one suffering from hypoxic brain injury due to delayed presentation. Rest survived with neurological recovery also. So good outcome in such cases related with early cardiorespiratory support and antivenom therapy.
So up to 20 vials was given here.
You have to agree, it varies, I told you, it varies. This is actually, this ventilator is required in case of elapid bites and Russell's bite. Elapids mostly. And in elapids, you have to give early venomation. Early ASP, administration is required, important. Here they are giving polyvalent anti-snake venom started as loading dose, 50 ml over 2 hours. 5 vials, 2 hours, IV push technique. And then maintenance infusion of another 5 vials, 6 hours. This 6 hourly procedure goes on. We have also used anticoagulants, neostigmines, anticholinergics, etc. Now coming to summary, snake bites may be by a non-venomous snake or a dry bite. Not all snake bites require anti-snake venom. Anti-snake venom is the mainstay in the treatment of snake bite. Anti-snake venom must be initiated if indicated at the earliest. Respectively, you don't give kill out time, just thinking I should give ASB or not. There are indications who guidelines, you have to see it, you have to read it frequently to remember whether to give ASB or not. There is no midway. Then the patient will be gone. Respiratory paralysis can be the cause of different reasons: neurotoxicity, shock, sepsis, renal failure. Mechanical ventilator may be the mainstay of treatment or just supportive depending on the cause of failure. Real snake bite cases, ventilator is very essential in most of the cases. I brought these references from this WHO and CRO, Southeast Asia Regional Organization Guideline, December 2009.